Good afternoon. I am Andrea Chisholm with the Midday News. A special welcome if you're watching on onespotmedia.com. The Health Ministry is again warning Jamaicans to prepare for community spread of COVID-19. At a press conference yesterday, Health Minister Dr. Christopher Tufton said the government will implement a different management protocol when community spread begins. Details in this report.
252 COVID-19 cases, with a tripling of positive tests in less than 2 weeks, most coming from the Alarica Call Centre in Portmore St. Catherine, representing a spike in the numbers before that outbreak. But for Health Minister Dr. Christopher Tufton, what Jamaicans are seeing so far may only be the tip of the iceberg. He said apart from the 1,146 people who are in isolation or quarantined at home or in government facilities, hundreds more who may have come in contact with positive cases are being sought.
In addition to the hundreds that are in quarantine or isolation, whether home or institutions, the team are in the field every day seeking to identify and to follow up with and to interrogate and to test and to collect samples of some 1,409 Jamaicans. And that number is a moving target. It increases each hour depending on the information and depending on the next confirmed case.
He described the process of tracing those persons as stressful and urged Jamaicans to play their part in minimizing the predicted community spread coming too early because of the impact it will have on the capacity of the health services to cope.
You just need to look at other countries where they have had surges, where patients cannot get ventilators, cannot get hospital beds, even in some very developed countries. And so the plan has always been to use restrictions to minimize, in the first instance, imported cases, to contain through contact tracing, through quarantining and isolation, the threat that may present itself in terms of potential cases, and to use that time to enhance the public health infrastructure in order to deal with what would have been an inevitable scenario given the nature of this virus, where it becomes more widespread across the country in terms of people picking up the virus from others and not even knowing that they have it because they may be asymptomatic and not knowing where it has come from, as is the case with earlier cases where we have a travel history that's linked to the virus.
This is called community spread. The authorities say they have seen signs it is beginning. It is not known as yet if any of the 148 cases under investigation represents that phase of the outbreak.
We want the Jamaican people to begin to start adjusting their minds to what community transmission and community spread is and what the implications are for them, for us in public health, what their role needs to be, and what are some of the adjustments and changes that are going to be necessary when we declare that we are now in community spread, because it's a different management mechanism that has to be put in place.
He said when the numbers start spiking, everyone who tests positive won't require or could be afforded a hospital bed, and many will be told to stay at home until they recover. For now, his message is simple. Stay at home and practice proper hygiene to minimize the chances of catching the disease. So far, 28 people have recovered from COVID-19, while 6 have died. O'Shane Masters, TVJ News.
Meanwhile, Chief Medical Officer Dr. Jacqueline Bisesa Mackenzie gave an update on the impact of COVID-19 on healthcare workers.
We've had 3 healthcare workers from the field that have tested positive, and we have, in addition to that, we have the 7 persons from the Ministry of Health and Wellness head office that have tested positive. All of these persons are doing quite well, and we continue to monitor them on a daily basis. We have 3 persons that are in facilities right now. we actually have 4 persons, sorry, that are in facilities right now, and they are doing well. We had 1 person that was moderately ill and that has improved quite significantly and is doing very well.
Jamaica is expected to be among regional countries to get coronavirus test kits from the latest batch provided by the Pan American Health Organization, PAHO. Director of PAHO, Dr. Carissa Etienne, says 4.5 million test kits are being dispatched to member states. 1.5 million kits will be dispatched throughout the region, followed by another 3 million next week. PAHO indicated that between February 13 and April 15, Jamaica got about 19,000 test kits, and that's along with additional material to detect COVID-19. On Tuesday, Finance Minister Dr. Nigel Clark is expected to address concerns regarding allocations for the compassionate grants on the government's COVID allocation of resources for employees care program. Parliament's Public Administration and Appropriations Committee PAAC yesterday questioned last week's closure of the application window. PAAC Chairman Dr. Wickham McNeil noted that some of the most needy did not get a chance to apply because they're unable to use the online application portal. Government Committee member Franklin Witter shared a similar concern and made this enquiry.
The compassionate grant is oversubscribed, and there are other of the grants that are undersubscribed. Will you be able to have that flexibility to recalibrate funds so that you could accommodate? Because one of the challenges that you face with the oversubscription of the compassionate grant is that some of these persons, especially the farmers, there are over 250,000 small farmers in Jamaica. There was nothing in the packet for small farmers. And therefore, all the small farmers went in on the compassionate grant. So these are some of the things I think you need to look at in terms of recalibrating some of those funds that would have not been taken up by some of the persons who have the registration and challenges with registration.
Financial Secretary Darlene Morrison said the Finance Minister could address the concerns surrounding the compassionate grants when he speaks in the House of Representatives.
Okay, sir. So as indicated earlier, we are and will be doing an assessment in terms of the applications that have come in, the areas that they have come in under, where the most are, and there will be a determination on what to do going forward. Right, so again, the minister will speak on Tuesday and may address some of
he's
the
going
issues
to speak on Tuesday.
Yes, he will speak on Tuesday.
And it's time for a break. More stories when we return. Welcome back, and we're continuing the news. As the number of COVID-19 cases increase in Jamaica, there are concerns about a lack of water. Residents of Stepney in southwest St. Anne say access to water has always been a major problem.
Say no water in the community, and the drought hand, nothing can done, no farming can go on, so you must imagine the situation. Right now, me there, me suffer real hard. When I tell you, me suffer hard because my baby father, he mental. He's sick, and me have 3 children around me. And me can't do nothing, me don't have nothing in the ground. Nothing at all to turn to.
Yeah, but we just throw a little water, we serve it for all the whole day before we change that. You see?
But that not, tell us, that's not healthy, man.
It's not healthy, but we have to do it. So we don't got nothing more.
He says some residents are able to buy water in neighboring communities. Ms. Lawrence, however, notes that the water in the tank in Stepney is discolored.
Yeah, but it green. It no, you can't use. Me no know how the people them use it washing up, but me no use that water wash. For that water can never good for wash your clothes.
Councillor for the Calderwood Division, Paul McFarlane, says he tries, but more help is needed from the government.
I have got like a monthly stipend to assist us with water, right, at $50,000. That is woefully inadequate. When the truck that truck water for the division, it is like $45,000. You realize that is one load per month. And maybe it will accumulate for $200,000. Right? So therefore, when I do like 4 loads of water in this time, it depletes everything. I just can't do any more. I just wish and hope that someone will hear the plight of the people and see how best we can address them.
While the government has outlined specific shopping days for residents in St. Catherine to help contain the spread of COVID-19, there have been no official guidelines for incoming patients at health facilities in the parish. Therefore, the number of incoming patients remain the same, particularly at clinics. That's why CEO at the Spanish Town Hospital, Dwayne Francis, has utilized tents outside. Mr. Francis explains that the tents will help to encourage physical distancing.
The tent will allow us to be able to continue the process of social distancing at the clinic area, putting up more benches so patients can sit further apart from each other, and also to support the patients who are coming here in the mornings for service, that they have a better area to wait on the outside until they are brought on the inside for the service to begin.
Based on what is happening in terms of the pandemic and social distancing is something that is the only thing that has created the positive in minimizing the pandemic. And we're hoping that, you know, this is part of the effort to ensure that we maintain that part of it.
Mr. Francis adds that on maternal days, the clinic receives an increased number of patients.
That clinic continues and with the same numbers, because those mothers will be coming on certain days and they come in large numbers. So we have to manage how we treat with those mothers, ensuring that social distance is maintained and also that the service that they require is actually delivered.
Another escapee from the Hunts Bay Police lockup is back behind bars. Roger Gaynor, otherwise called Screechy, turned himself in yesterday afternoon. That was disclosed by head of the St. Andrews South Police, Senior Superintendent Dwayne Cameron.
5 of the escapees are back in custody. 1 is deceased, so there are 2 inmates who are still out there. They are Michael Orlando Ellis and Kenor Holness, otherwise called Oliver. We are asking residents, especially in and around the corporate area, to be vigilant and to be on the alert. And any sightings of these 2 individuals, these 2 escapees, please to call the police, call 119, call Crime Stop, call the nearest police station. In the meantime, I must use the opportunity to thank residents for their cooperation. In those 5 persons who have been returned to our custody, and as I mentioned before, 1 is now deceased, but I want to express our appreciation to the residents who have supported us wholeheartedly in this cause.
Meanwhile, SSP Cameron says the captured prisoners have been isolated from the general population to ensure they have not been infected with the coronavirus. He said they're receiving regular temperature checks. In news overseas, the state of Georgia is aiming to reopen by this Friday, despite a warning from a key coronavirus model showing it shouldn't open until at least mid-June. But what are the likely implications of the move? For that, we go to the CNN.
President Trump signing an executive order suspending immigration into the U.S. for at least 60 days.
This will ensure that unemployed Americans of all backgrounds will be first in line for jobs as our economy reopens.
This as the U.S. announces $270 million to help other countries with their coronavirus fights. But after a pledge by President Trump, not the World Health Organization.
The World Health Organization's regulatory arm clearly failed during this pandemic.
The organization defending its actions.
Looking back, I think we declared the emergency at the right time.
Amid debate over the past, concern about the future. A model from the University of Washington suggests no state should be reopening businesses before May 1st. This as Georgia prepares to allow some businesses to open Friday, a move the president doesn't support.
It's just too soon. I think it's too soon.
Elsewhere, officials like the mayor of Las Vegas say things aren't moving quickly enough.
I want our restaurants open. I want our small businesses open. I want our people back in employment.
Governors in states like California not bowing to pressure.
We have tried to make it crystal clear that there is no light switch and there is no date.
Some relief for businesses is likely on the way. On Thursday, the House is expected to clear a $480 billion package with funds for small businesses, hospitals, and testing.
Although yet to make a decision on her immediate future, outstanding young Hyde High sprinter Ashanti Moore could be heading to an overseas university. But with the continued uncertainty being posed by the COVID-19 pandemic, the fight is on to keep the young athlete and others mentally focused on the sport. More in this report.
The clash between Hyde High's Ashanti Moore and Edwin Allen High's Kevona Davis in the Class 1 girls sprints had promised to be one of the highlights at this year's ISSA Boys and Girls Athletics Championships. But that clash was dashed with the cancellation of champs. Moore, in her final year of high school, was hoping to defend both the 100 and 200 meter titles in Class 1. So what now for the 19-year-old who had season's best of 11.47 and 23.94 seconds for the 100 and 200 meters? Her coach, Corey Bennett, says several U.S. college offers as well as interest from shoe companies had come in before champs was cancelled. But he says going pro might be too big a shoe to fill at present, with even the shoe companies struggling in the current crisis.
I know the last we discussed was probably her going to college. It's just a matter of, I know that they cut out the SATs now in terms of for this year. So I believe that it is heading towards college. I know that there are some shoe companies that have an interest in her as well, but we haven't spoken to anybody, and I don't really want to preempt anything like that.
And with the COVID-19 pandemic posing great uncertainty around the world, including in the USA, which is now hardest hit by the virus, Coach Bennett says keeping the young athlete and others mentally focused on sports and their budding careers is proving a tough challenge.
Her future's ahead of her. Now that the dust has settled and we can think a little better now. I'm hoping that she can transition to the next level of and feel. I think she has some scope to go to the next level, and I'm thinking that as much as the disappointment is there, we must look at the brighter side and hopefully she'll not be too dejected to put on track and field, because it is devastating to be preparing and just not have chance to showcase it any at all. And for young minds, those young minds can't process that sometimes.
Jermaine Brown ending that report. And that's the Midday News. I'm Andrea Chisholm. Join us at 7 for the Primetime News Package. On behalf of the news, sports and production teams, good afternoon.